Thanks everybody for being here. This is the System of Care Advisory Council Learning Collaborative, and Christy asked me to come to tell you all about the two System of Care Advisory Council legislative concepts that will be working their way through the legislature in the 2025 session. Um, and as things roll with legislative work in general, there are some last minute updates um, to inform you all of relating to some other legislative concepts that are very connected to the work of the System of Care Advisory Council as well. Um, so the first one that I will share with you is legislative concept 429. I'm not sure how familiar you are with the legislative process, but there's this weird thing where you get a bill drafted and it is called an LC or legislative concept and it has a number associated with it. And then when it gets loaded onto OLIS, which is the legislative information system that the public can engage with, it like becomes a bill and it gets a different number. And as far as I can tell, those numbers are completely disconnected from one another. So LC 429 in very short order will have a different new number associated with it. Um, I don't know what that number will be. What you're seeing on your screen, hopefully right now, is the sort of one pager. It's really a two pager for the legislative concept 429. And the intent behind this bill is to increase the number of people with lived experience who are governor appointed to serve on the council. What we have gone in and done is if you look at Senate Bill 1 or Senate Bill 4, which are the founding pieces of legislation that created the System of Care Advisory Council, they list all of the seats and who needs to sit in them. And so there are two seats for family members with lived experience and two seats for youth with lived experience. All we've really done is gone in and delete the two and replace it with a four. So we will have four seats for family advocates, people with lived experience as a family member of a youth who is navigating the system of care, and four seats for youth who have personal lived experience in navigating the system of care. One other important change was made in that bill, or will be made in that bill. It didn't come in the legislative concept, but we'll be amending it once once our next opportunity comes when it has a hearing. And what we're doing with it is taking out the language that defines eligible youth as wards of the state. Our youth council has mentioned that that is a position, a phrase that feels really stigmatizing and dehumanizing to them. What a ward means is someone who has been legally in the custody of the state. So if you have been in foster care, if DHS has assumed legal guardianship of you, if you have been in the youth juvenile justice system to where the Oregon Youth Authority or county juvenile system has assumed legal guardianship of you, you have been considered a ward of the state. And so instead of using that ward language, we're just going to name that if you have been in juvenile justice, if you've experienced juvenile justice, foster care, or the IDD system as a resident, then you would be eligible for that seat. So we're going to have two seats for those folks and two seats for folks who have primarily experienced the system through the mental health door. Nothing will change about the way that the family seats are defined currently. And then there's funding associated with this bill that would fund Corinna's position. She's our admin assistant. She makes sure that people with lived experience who are eligible for payment for their work with us get paid. Pretty necessary. And Joylene, who is our youth and family engagement specialist, and she does all of the, preparing the table and then supporting people who are sitting at the table to help improve the meaningfulness of the engagement of youth and family in the space. And then there will also be some additional funds to support the stipends that we provide. As we expand the number of people who are eligible for them, we will also need to increase the funding that we provide to make sure we can pay these folks for their work. The Diversity, Equity, and Inclusion Committee did a GARE, Government Accountability for Racial Equity is what GARE stands for. They did a GARE review on LC 429 and at their last DEI committee meeting and have some questions. They're looking for some data that our data person, Cody, is digging into. I don't know when we'll have that completed. I assume by February, and then we'll post that on our website along with the bill so that you can see both the bill draft language and the equity analysis connected to it. So that's 429. Questions, comments, anything folks want to dig into on that? Okay. Um, Seeing none. Oh, somebody's video just moved, but okay. I thought maybe there was a hand raised. The other bill is the one that is more controversial. This is Legislative Concept 346, and I will share. This is available on our website. The plain language with recommended amendments. It may not be the most updated version. We made some changes during the last week, Monday or Tuesday and Wednesday. I'm sorry, I'm trying to get, there we go. Now I can see you all. And so this is the most updated version. So this bill is a regulatory reform bill for primarily focusing on what are called children in care. So again, those are people who the state has assumed custody of or responsibility for. They're mostly DHS kids. They also could be kids in the IDD host home programs or kids who are in youth authority or county juvenile custody or responsibility. You may have heard, I feel like I've said this 1,000 times in the last 2 weeks. There are currently 4 different definitions of third-party child abuse, which is child abuse that happens to a youth who is in one of those settings or by a provider in one of those settings. What this bill, LC 346, would do is create one consistent definition across all of those settings so that youth who are experiencing care know what's okay and what's not okay, and it doesn't depend on who's paying for your care or which door you walked through to get into that care facility in order to know which rules apply to you. The reason really behind this concept was sort of a little pathway that we went on. Access to care is a huge challenge. Oregon is ranked, depending on where you look, 51st to 47th with regard to access to behavioral health care for youth, and 2nd to 8th for the highest rate of juvenile incarceration in the country. And we really believe that those two statistics are one thing, right? If you can't get access to the care you need, you may end up incarcerated or involved in the criminal justice system. And access to care has been this big thing. We've had also, funding increases and looking at the workforce shortages and all of this different work that's been happening at the legislative level and at the agency level to try to figure out how to increase and improve access to care. The System of Care Advisory Council, after hearing about some challenges with access to care, particularly for kids with complex needs around histories of aggression or needing certain types of medications, or kids who have needs that can't be met by facilities that exist in Oregon, went to providers and asked, what would we need to change in order for you to say yes to these kids? And that conversation resulted in LC 429. No, I'm sorry, 346. And again, that'll get a new bill number once the session starts. Basically, what it does is, like I said, takes one clear and consistent definition of third-party child abuse, and also one consistent, clear definition of both wrongful restraint and wrongful seclusion, and applies them across all of the different settings. It also creates very limited opportunities or exceptions for the ban on out-of-state placements for children in child welfare custody. So kids currently who are using Oregon Health Plan or private insurance but are not child welfare involved are able to go out of state to seek specialty care that they need, but kids who are in the custody of child welfare are not able to go out of state to seek the appropriate care that they need. So this bill would create a process for that to happen with lots of oversight involved. and would allow kids on the far eastern side of the state or anywhere far away from the I-5 corridor where the vast majority of our high intensity treatment facilities exist, could potentially be placed out of state if that facility is licensed by Medicaid, appropriate to the care needs, and closer to the family home to try to maintain connections for kids and their families, or kids and their foster families, or whoever it is that they would be disconnected from if they were sent all the way to the valley. And their families had to travel to maintain connection or participate in family therapy or whatever those recommendations are from their care providers. There are a lot of other sort of minor tweaks that this bill makes that I'm happy to dig into if there are folks who want to talk about them. Some additional highlights. It's really long. This is the plain language version, and it is 17 pages long. The actual bill, I think, is 104 pages long. And it's pretty confusing to read. So it is linked on our website. I'm sure, Christy, did you put the bill draft link in the chat?
I dropped the brief, which I know is
Okay.
also being updated, but I
Okay.
think
Yep.
that's a little bit maybe of an easier entree.
The new brief will be out later this week as well, so updated to all the amendments that were suggested and accepted at the January System of Care meeting. So public education has a different definition currently of wrongful restraint. So these sections align all of that. One of the things that we noticed as we were walking through it was that at school, you can be restrained for 30 minutes in a row without any certification that that hold is still necessary. This bill will change that to 10 minutes, as is the case in every other setting. And then again, in schools, they only had to recertify every 15 minutes. So you could be in a hold for 30 minutes and then not get recertified again until you'd been in a hold for 45 minutes. Now it will be 10 minutes and every 5 minutes you need to be recertified. So as soon as that hold is no longer necessary to protect your immediate safety or the safety of someone around you, you would need to be released from that hold. You also need to be offered an opportunity to use the bathroom or get a drink after 10 minutes. And if you say yes and you can calmly do that, then great, hold is over. There's no way to go back into the hold. It would take secure transport services. Right now, they are overseen by both DHS and OHA. So secure transport that's non-medical would be moved over and just be overseen by DHS, and any kind of medical transport would just be overseen by OHA so that the providers can understand who is responsible for licensing and overseeing quality of care that they provide. It takes out the people who would be investigated for different types of abuse, including abandonment and neglect. Currently, for third-party abuse, if you're a child caring agency, caretaker, certified foster home, developmental disability residential facility, or other person responsible for the care of that child, you could be investigated. But if you did something that met that definition and you weren't one of those people, you would be investigated under a different statute that has different rules. Now, if you're a child in care and this bad thing happens to you as defined, then that's investigated under the third-party child abuse rules. Like, it's just, we're trying to just make it really clear that, like, if you're in this bucket, it all plays out the same, no matter where in the system you are. So that's the case for seclusion or neglect and abandonment. Clarifies that anyone having sexual contact with a child in care is investigated either as third-party child abuse or as a crime, and probably both. It clarifies that mechanical restraint is always illegal in Oregon.
So hold on.
That actually, as we've been walking through all of this, we have discovered that DHS is currently legally allowed to use mechanical restraints to transport children. They do not and have not for some time, but they could put a kid in belly chains or ankle chains in order to move them from one place to another. And so that will be banned if this bill passes. It also adds, this one was interesting. So permissible use of restraint or seclusion adds to protect animals in the setting. There have been some times when youth in care have been harming animals intentionally, and there was nothing to be able to be done about that. Other kids were witnessing it. It was traumatic. So if this is imminent risk to harming an animal, and a less restrictive intervention will not reduce that risk, then an approved hold could be used. It clarifies how video of any of those restraints or seclusions can be used or shared, so that a youth who is in custody in a care facility, their family would have the right to or a legal guardian would be able to see the video if they're under 18. If they're over 18, some youth continue to stay in facilities until their 21st birthday, in youth facilities until their 21st birthday, then they would be able to consent on their own to the disclosure. And the disclosure would be an opportunity to view the record, but not keep or own a copy of the record. That comes from the self-advocacy community, really worrying about what could happen if copies of those records ended up on the internet. It expands the number of approved crisis intervention models from 2 to at least 4, so potentially more, and requires that DHS convenes a panel of youth and families with lived experience to make recommendations around those approved models. And again, clarifies that the focus and priority should be on de-escalation and trauma-informed support, reducing and eliminating the use of restraint and seclusion, and ensure any physical intervention skills are intended to reduce the risk of harm, including psychological harm, and of course are consistent with all state and federal laws. This isn't something that I think is good. It adds that all youth in care must be informed of their rights and what restraint, seclusion, and abuse statutes are that apply to them, and how to report those, how to find an advocate to connect around those things. And then again, there's this already existed, that they need to be able to have the toll-free number of the hotline and the Disability Rights Oregon and other resources. It requires Oregon Department of Education to investigate restraint or seclusion that takes place in schools that is ruled not to be child abuse, but is ruled to be problematic in some way. Currently, the school districts investigate themselves. And that does not feel appropriate to a lot of parent advocates, specifically, who have had bad experiences with schools investigating themselves. There are a couple of sections that are in here that shouldn't be, so they're just like, no amendments were made in this section, so that we're going to pull them out in the next version of the legislative concept. It requires video in schools in certain rooms that are used for disability services or seclusion rooms, and there will be cost associated with that. And then it also defines for times when something happens, like a provider uses a restraint that they have been trained on, but their training is lapsed within a short period of time lapsed, or there aren't enough providers on the floor to prevent the need for a hold because we've got like the de-escalation strategies happening, something like that, that a finding could be made against the facility instead of having just the frontline workers be founded for child abuse when they're not provided the resources and support that they need by their management. And I think that's really it. Like those are the highlights. I'm happy to dig into any of the details if folks have questions. But Christy, did I miss anything that you were like, Anna, make sure you cover this for the folks at the Learning Collaborative?
Do we want to talk about the respite?
Yep, I'll go there next. So in this, all the public conversations and the votes and decisions that had been made around this bill, there was a decision at the legislative committee meeting on January 8th to include recommendations from, nope, is it in here? Nope, it's not in here. To include recommendations from the respite work group to direct the Oregon Health Authority to enter into a state plan amendment to allow for Medicaid coverage for respite that does not require you to be child welfare involved or IDD involved, right? That's sort of just broad access to respite via the Medicaid process. That has about a $2.1 million cost for the state, and then a match from the federal government via Medicaid for, I think, is it 2.8 million? So it's about a $5 million fiscal impact to the state. The committee had originally voted to include that respite request in this legislative concept. After that conversation, Senator Reynolds reached out and said, "Oh my gosh, I love this idea. Can I drop it as a separate bill just so that we have a clean, in case anything goes wrong with this one, we can still get this respite idea through the legislature?" Of course, I was like, "Yes, please." Um, and then there was some conversation just today with some of the executive leadership at the System of Care Advisory Council, including the legislative committee chair, as well as the governor's office. Oh, thank you, Christy. I was wrong on the numbers. That they feel like adding the respite request into this bill is maybe inappropriate because this is a regulatory reform bill and that is a program design and development bill. And so the respite component will not be included in this bill, but will be processed via Senator Reynolds' office, and the SOCAC will support that. Whatever level of support we can muster, we'll have to have a conversation about how aggressively are we able to engage in getting that bill across the finish line. So we'll also be running, and I don't have a number for it yet because it hasn't come back from the legislative drafters, a bill that just says, "Hey, OHA, go make respite a Medicaid covered service. Here's the money that you need to do that." And then we also have two bills that are Oregon Youth Addiction Alliance, which is a partnership between the System of Care Advisory Council and the Alcohol and Drug Policy Commission around youth substance use. They have two bills that they are pushing that are youth generated. One is called Treat Right Oregon, and the other is called Home Hopeful Oregon. Treat Right Oregon provides financial supports for youth experiencing substance use disorder to access insurance and supportive care. And Home Hopeful Oregon provides supportive sober housing for youth who are exiting substance use disorder care, so that they have a place to go, and not a lot of the youth that helped craft that bill were discharged from substance use disorder treatment facilities to homelessness. And that obviously is really hard to continue to stay sober. So those two bills as well will not be getting, to be really honest, as much support from the SOCAC as the other three that I listed first. We don't have the capacity. But those youth are getting advocacy training and support through the SOCAC and through some of our contractors, and we're going to kind of walk with them as they learn how bills move through the building. And so these are bills that they know are not likely to pass, but are really important conversations to have with the legislature, where youth are going to go forward and tell the legislature, "Here's what we've seen, here's what we need to see change. How are you willing to partner with us on that?" So we're really hoping that the testimony on those bills informs some of the bigger drug policy bills that will be moving through the Joint Committee on Addiction and Community Safety. And those bills were actually dropped by the chair of that committee, so he's pretty excited to partner on that. So those are all the legislative concepts I have to share with you at this time. I don't know if you want to talk about how you all might want to get involved, or questions on the contents of the bills, or tell me to have a nice afternoon.
There's gotta be questions out there. Things you've heard, confusions, concerns.
Celebrations.
So I saw in the chat that Amy said a lot of family and youth voices have a lot of concerns about LC 346, and I was just wondering if I could hear more about what those concerns are. I want to understand all perspectives.
Yeah, good question, Kat. Amy, is that something that you want to speak to, or is that something you'd prefer I speak to? I'm happy to go either way.
Why don't you start while I get my thoughts together?
Sure. So and Christy, oh, I can just do it. The maybe easiest way to really understand the concerns would be to watch the public testimony that was provided at the last full council meeting, where folks came and shared their concerns in their own words, I will put a link to that recording on our YouTube page here. So that way I'm not putting words in folks' mouths, but they are speaking to their own concerns. My understanding of the concerns are really fears that this would make it easier for youth to be put in restraints or seclusions, easier for restraint or seclusion to be dismissed as not wrongful, if it happens. Um, Worries about out-of-state placements and the lack of maybe transparency or accountability, and kind of going back to what was previous to I believe it was Senate Bill 1515 that banned those out-of-state placements. There's some concern around some of the ways that definitions have changed that may like, these are not my concerns. I don't think that this is accurate, but that there is a potential for sexual contact between like a foster provider and like a boyfriend or somebody else, another adult in the home who is not contracted or employed by DHS to be sexually inappropriate with a foster youth, and that there wouldn't be the same types of interventions that would be provided under current statute. I think, I mean, the like overarching umbrella of all of it is safety concerns. People are fearful that this would put young, vulnerable people at risk, with a particular focus on youth with intellectual developmental disabilities or any other type of disability.
Thank you. That's helpful.
Yeah. And Amy, if you want to add.
Oh, sorry, my thing's on. It really feels like a provider-driven bill. It feels like a response to Disability Rights Oregon and CASA suing the state around the treatment of foster care kids. The anecdotes in both the OPB article and in the SOCAC safety report feel very cherry-picked. They do not reflect any lived experience I've ever heard of a child being restrained and secluded. And definitely not the voices in the NAMI, the report that OHA paid NAMI to put out about BIPOC kids' experience in residential settings. So that makes me not trust when the anecdotes picked are basically like, I liked it and I needed it. You know, I have a child who has trauma from that happening in the school setting, and I know a lot of other parents and kids that do, so it just does not feel reflective of that. And I mean, I do appreciate that Anna has been, and the group, you know, like we have been giving our feedback and concerns, and there have been changes made. I'm not sure. I don't haven't fully read the current version as of like today, so I'm not sure, you know, where my concerns are now. We have another meeting tomorrow morning with the SOCAC Legislative Committee. So yeah, that's kind of the highlights. And I don't know if Jenny or others have other things to say.
Yeah, I can say I put in the chat one of the concerns about changing the language from severe harm to serious physical injury. Is that what it is? And how that doesn't allow for consideration of trauma, and how a lot of kids already have PTSD from being restrained and secluded on repeat. And my son had this lived experience. So then the more often it's like it's a self-fulfilling prophecy, because they have trauma from being restrained and secluded, then you restrain and seclude them, and then they're more traumatized, and then you do it more. So not considering the emotional trauma, and that feels also like a way to cover the system, in the sense that if a kid has been severely harmed and has PTSD from repeated restraint and seclusion in a school setting, there isn't any way to go back and look at this and say that that was something that was that was problematic. So that softer language doesn't feel safe when it comes to the emotional and mental well-being of children.
Just to, I just, here, I'll share the language just so that we're all looking at what it says. And Jenny, if this isn't the section that you're referring to, please correct me. So what the bill would do is actually remove the phrase severe harm. No, it replaces the phrase serious physical injury, which is currently the term that wrongful restraint must lead to significant or serious physical injury in order to be a wrongful restraint, and replaces it with the term severe harm, which is a broader term that has a lower threshold. So I guess I'm hearing, like when I look at the words, I think they're doing what Jenny's concern is instead of being the origin. Like that's confusing to me, right? Because we're taking out serious physical injury and we're replacing it with severe harm, and severe harm could include psychological, emotional, sexual, any other kind of harm, right? Not just a physical injury.
Okay, so I guess I'm reading this wrong. Amends definition of wrongful restraint to remove requirement that the action is likely to result in severe harm and replaces it with the lower threshold of serious physical injury.
No, I'm wrong. You're right. Thank you, Jen. No, you're right. Yeah, so you're right. It focuses on physical injury, and it clarifies, and I know this is a concern that some of the parent advocates, at least in this room and probably elsewhere, have had, that it's not wrongful restraint if it is aligned with the developmental stage and individual needs of the child in care. The words in the bill, what it really is talking about is like times when you pick up a kid in a store and because they're, licking the bathroom floor. That is currently a prohibited restraint under Oregon law. And the intent is to make sure that parents can do normal parenting things without being investigated for child abuse.
Yeah, and that is where I know, Anna, I shared with you, but since you asked Kat, I know this is the plain language version, but it says aligns with the oops.
I'm sorry.
Could you
Oh,
share that
sorry,
again,
sorry. I
Anna?
did not know you were going to start reading it. I was like, I want to be able to see your face. Here-
Okay, so restraint not wrongful under the definition if it aligns with the developmental stages and individual needs of the child in care and is intended to support the healthy development and well-being of the child in care. That concerns me as well because my son is also an ABA therapy survivor with PTSD from hand-over-hand compliance training, which is sold to parents as intended to support the healthy development and well-being of their child. But technically it's child abuse, which now if we're not looking at severe harm and we're only looking at physical injury, that is another place where it makes me feel concerned about the ABA industrial complex and how it can use this language to infiltrate our schools and other settings where children can be traumatized by it.
I guess it's kind of unclear, like what problem, like why we had to change the language in the last. Because if you dig into things like ODE's document on, where they gave schools advice on how to implement the last version, it does have examples of like if a child is running into the road or, up high or, in an unsafe structure or about to do, about to hurt themselves or someone else, that you can touch them. But yeah, so it just, I don't understand what problem this is trying to solve from where we were. And it still really feels like it's about the liability of the systems and a response to lawsuits. And then it feels very disingenuous that it's not really about protecting kids because it's about protecting the behind of the system, is how it feels.
Thanks, Amy. So that ODE guidance applies to the definition that exists currently for schools, but it doesn't apply to the definition that exists for foster care providers or other types of third-party care. And in the foster care setting, running or child welfare, like if child welfare workers, right, there was a young person who died at the end of July because he was running in the road, and the DHS caseworker was unable to put hands on that young person to stop him, and also was so the worker, in his own words, had to choose between him being investigated for child abuse or being investigated for neglect, because if he had touched the youth, he would have been engaging in a wrongful restraint. And if he had not touched the youth and the youth got injured, which they did, then he engaged in neglect. And so the reason for that, Amy, is like the consistent definition across all settings, then applying both to the child welfare setting as well as the school. So currently that's an option in schools, but not an option for foster or child welfare.
But then the language has been changed so much from that language that Sarah Gelzer-Ploen, who is a parent with lived experience, very intentionally put in place, who listens to parents with lived experience and is all about protecting the children. So then it's like, why has the language changed so much? Why not just make it so that like that language is now covering those other settings, and then that in the rules or whatever gets rolled out into the implementation part where people actually get trained on the new rules, you know, then that's made clear in the training of staff. I just still, anyway, I mean, we could do this all day probably, so I don't want to take up the meeting doing that, but
yeah.
I think there's some trust issues in our concerns, is what you're hearing.
Yes, and noted. The other piece that I wanted to just reply to was this feels like a provider bill, and I agree with you. It feels like a provider bill, and the bill was really generated in the process of, people not having access to care, families coming forward saying, why won't you take my kid? Us going to the provider saying, what would help you say yes? How can we get to where you'll take these complex kids that you have been turning away more and more so over the past 5 years? How can we stop losing provider agencies? We've had a 50% decrease in some areas, 100% decrease in other areas for facilities that provide high intensity care. And these were providers that said, this is what we would need to see change in order for us to say yes and protect the safety of the kids. So it is a provider. I mean, yeah, you're right. Feels like a provider bill because a lot of the ideas that address the reasons why they're not taking kids today came from them to say, this is how we could get to be able to care for these kids in the way that DHS and OHA are asking us to do.
Yeah, and it would be beautiful if providers were looking upstream at co-regulation, training their staff on co-regulation and, sensory safe environments and collaborative problem solving, because then there would be less kids having meltdowns or getting to the point that they're escalated to the point needing restraint and seclusion. But we'll get there. We'll have to be another bill.
I just wanted to throw a plug in. I just came out of the Nurtured Heart Approach training being offered free through Oregon Health Authority, and being married to an educator. I'm very excited to share that with him. And so I'm just to throw in another opportunity there, which I know that a lot of us scramble for. I just wanted to throw that one in. Is it appropriate to ask a question that's related to this process, right? It's not directly, I do not want to move forward the importance. I cannot express enough the importance of hearing from Amy, Jenny, and anyone else who has concerns and wants to report on it, especially what it truly means, what this bill could truly mean. So I do have a follow-up question, but I want to make sure that I'm leaving space for continued conversation and not just overlooking the importance of ensuring that folks are heard and that the potential for any changes is addressed.
Julia, are you responding to, you have more you want to say?
Yeah, I just want to share another anecdotal experience from my own family. So I'm here in dual roles. I'm here as like a family member of youth who are adopted out of foster care and who both have intellectual developmental disabilities and complex mental health needs. And I'm also here as system of care coordinator for Multnomah County. So hello. And so I anecdotally, like, I see both sides, right? Like, because I see in the job, like, us not being able to care coordinate and get kids into the level of care they need at that time. What I'm also seeing is what I'm pointing out in the chat, and thank you, Amy and Jenny, for speaking to this so well and in every space you're in, like, you're amazing advocates, because it's so true. is seeing that it's a symptom. Holds are a symptom of our systems not providing the upstream support that they were referencing, and like just not providing, even within schools, within those higher levels of care, within residential settings, subacute, there are not enough staff and supports to really meet these kids' needs if they're in that level of care. And that, like y'all are saying, from the provider side of things, there's a huge liability with this new bill. And at the same time, like, where do we start? Like, so I get why this bill was initiated, because we need to stop hurting kids. We need to stop this child abuse. Frankly, it's child abuse that's going on. And also, there isn't like the investment, honestly, still, even with tons of money going from the state, and there's still not enough of an investment in upstream services to help families not have to have their kids go to higher levels of care or go to DD placements. So the anecdotal thing I'll share is my brother, one of my brothers has FASD, fetal alcohol spectrum disorder, lots of trauma, some other mental health stuff going on, and he went to I won't name the name of the school, but he went to a therapeutic school, and they were constantly putting him in holds even after this bill. And it was just like, and there's a lot of concern for my family. We might pursue legal action, but the principal herself said, like, they put him in a hold because they needed to get staff back to their classrooms. So they're like, you need to just put him in a hold and call police. So literally he's in a therapeutic school known for needing lots of support, has all these other kids who are also struggling, activating each other and everything, and not enough staff to safely keep him in a hold, apparently, and be able to support the other kids who are in other classrooms. And I couldn't believe that came out of her mouth, because like, that is usually people don't admit that, but it actually was said. And so the truth is out there, that it was not actually clinically indicated that he needed to be put in a hold. And then police were called, and they were like, and they've also tried to put charges on him. And I'm like, what is the point of this school? Like, is this a therapeutic school or not? And clearly it's not. It's a traumatizing, horrible school that I will talk to people offline about which one it is, but it's horrible. And so my fear with reducing some of these the language in these bills is, I really get the provider side. Trust me, I'm trying to get kids into residential all the time, and at the same time, I'm also on this other end as a family member who is like, this is unbelievable that this therapeutic school, they are funded for this, they're supposed to have all this support, all this stuff, that they are still calling the police, of all things, much less putting kids into holds unnecessarily because they didn't have enough staff to continue the de-escalation and the one-to-one engagement, supposedly. So I say all that with, like, I understand where they're coming from, like liability, staffing issues, like we need to be able to put kids in holds. And at the same time, I'm worried about changing a bill to Band-Aid system issues. That's going to cause more harm from systemic care, perspective. And so I know there's can be both and all that stuff. And at the same time, like, I'm still frankly not seeing enough investment in upstream services. So I don't know. I just wanted to share. Thank you all for listening and hearing that perspective, because I really do get it from both sides. And I also just think that I think holds are used way too much. Like, really, they should be so infrequent. And there's a lot of issues with staffing that are causing more holds to be caused, or more holds to happen. So just want to put that out there as well. Thank you for giving me time to talk.
Thanks so much, JB. Really appreciate you sharing that. Joylene?
Hi, everybody. That honestly was a perfect example, and I'm processing, but something I wanted to offer, at least, Anna, you've been living in this policy, there was a family member that brought up the suggestion. I know you all are talking about moving upstream. We had a family rep suggest that we do that by including a group specifically for family members and youth with lived experience. Anna, would you mind sharing more about that specific piece of this bill, that amendment? I think it was related to having folks with lived experience actually determine and suggest some of those strategies to, like some of those alternative intervention strategies to
So it's just
providers.
to suggest which crisis intervention strategies would be approved by DHS. Currently, DHS just makes those decisions on their own in a vacuum. This would create a family council that of people with lived experience of having children or being children who have experienced holds or seclusions in the system, make recommendations around what types of crisis intervention strategies should be adopted by as approved, right? So if anything that's not on the approved list is used, that's an automatic investigation for child abuse. So it's not necessarily like the nurtured heart stuff that's more upstream, right? It's the actual, like, all of the intervention strategies per federal law that allow holds or seclusions have to prioritize de-escalation and prevention before going into any kind of hands-on or isolation experience. But it's those models of like, okay, what does the de-escalation strategies look like when those don't happen, when those don't work, what do you do next, right? There are models that are approved, and anything that's not in those approved models is child abuse.
Like MANT and what's the other one that starts with the
EPI,
O? And there's the O
OIS.
one. OIS,
OIS.
yeah, those kind of things is what you're talking about, right?
Yeah.
Yeah. And in the schools, they're all getting trained on MAT now, and they're still restraining and secluding children every day. So it's still not upstream enough.
Yeah. And there are other stream
It
efforts.
actually makes them do it more in some ways, I think. Unfortunately, like the more like it's the hammer nail thing. Like, I don't know. It feels like that a little bit. Like it's
Yeah, I could see that, right? Like like you just said, Amy, like when you have a hammer, every problem looks like a nail. Right. And so now that they have the strategy, they may be more likely to use it than they would have had they not been trained on that. I think that's accurate. And one of the things that this bill would require if passed would be that we gather data on our holds increasing. Are holds increasing against youth who have disabilities? Are they increasing against Black youth? One of the things that we can't currently look at is like Black youth with disabilities, right? We can't pull those intersectional identities out of the existing data and see if there are more instances of restraint or seclusion being used against youth with disabilities who are Black, or youth with disabilities who are white, or youth with boys who are, whatever. We can't combine criteria. It's just those by those demographic segments that the state counts. But we will be responsible for studying what is the impact of implementation, and are we seeing better outcomes for kids? Are we seeing better access to care for kids? Are we seeing more holds being used against kids, right? What does that look like? And then publicly reporting on that for ideally ongoing improvement to the system with regard to this like deepest level of care, right? That just because we're doing that work doesn't mean we're not doing any other prevention or upstream work. There is quite a bit of upstream work happening in the legislature, or bills happening in the legislature, like the Momnibus bill that Senator Reynolds is running, that really starts before birth and provides support for families who are experiencing pregnancy through home visiting, family support, financial support for families to maintain stability during that time. She read in the New York Times, she told me once that families with children who are under age 1 are the most commonly evicted families in the United States. And so her Momnibus bill is really looking at providing that stability in the first 18 months, like pre-birth and then year of life, right? Of making sure that we don't have those destabilizing stressors that create the environment where mental health or other challenges are more likely to appear.
Yeah, I was just going to say, as far as the hammer and the nail, I just kind of want to name it that when it comes to this stuff, the nail is behavior. and the hammer is behaviorism. And so, like you were saying, when all you look at is behavior, all you see is behavior. And that's how we end up not looking deeper at trauma and like that language around severe harm that can be trauma and emotional harm and those types of things. So the focus on behavior is part of that vicious cycle.
Yes, like my kid had no bruises, but they were reenacting, putting themselves in the principal cornered them with a cart, and then like they had a meltdown a month later and reenacted that. We were at a friend's preschool and they pulled a cot and put themselves in the corner and reenacted being, restrained in a corner. So those are things like how trauma plays out.
But I see JB's question, and if you've got your hand raised to say it out loud, then I'll stop talking and you start talking.
Yeah, I just wanted to bring attention. I just before we go to the next topic, and I think a couple of us have to go to a different meeting at 4, but I really appreciate the time. I have a follow-up question to this because it's related to, I think, very much related. These therapeutic settings, I'm thinking of schools, residential, all these places. If a youth injures staff, my experience with my family has been that they have the option to press charges against the youth. Clackamas County is where my brother resides, and they actually pursued charges multiple times that were eventually dropped. I can't, yeah, cat, I know. I was just like, what? And so it's not like it's out in the community. It's not a random person. It was all directly related. And one incident was related to, he was being put in a hold at the therapeutic school and he bit the staff member who was putting him in a hold, and they told the staff member that they could press charges, which the staff member was awesome and like, no, like I'm not here to press charges against kids who are, need our support. And so, but he had that option. So I'm just curious. I know that's like a cross system thing, but I'm curious if the bill talks about that at all or addresses that at all.
It does not address being able to press charges. That's the first time that like concept has, I mean, of course that happens, right? To your point, JB, where cops are called regularly when holds and things are happening in facilities or in schools. But the idea to like prohibit pressing charges in those contexts I've never even thought of that until you just said it out loud. The only thing it does relate to is school resource officers and the ones who are contracted or paid for by a school district would be required to be under these same prohibitions regarding restraint and seclusion. Some law enforcement agencies provide and pay for school resource officers that are not connected financially to the school district. They are not. There's no way for us to figure out how to include them into this bill. So peace officers who are separate from the school district, having no financial relationship with the school district, can still use all of the prohibited holds that are named in the bill because they're not regulated under this. They're regulated under the law enforcement statutes, which allow for a lot more physical intervention, to use a euphemism.
Thank you for that, Anna. I appreciate that.
Yeah, you're welcome. Haley, I know you had a question.
I do, but I want to call attention to Rachel's question. It says, I'm curious to know how, if these bills inform connect to early learning state programs.
You mean like the work of the Department of Early Learning and Care?
Yeah, Anna, this is Rachel. I was just curious to know if this informs or impacts early learning programming as well in regards to what it's asking or telling folks now to do and not to do.
I don't believe it has any connection to like preschool settings. All of the rules around prohibited restraint and seclusion in those settings are in the school district statutes and not the child and care statutes. The only places where we've picked up the school statutes is around that definition of third-party abuse. So if somebody in a preschool were using a prohibited restraint, they would be potentially investigated. They would be investigated under the same statutes, right? So I guess, yes, in that if you're using a prohibited hold in a preschool, you would be investigated in the same way that you would be if you're using a prohibited hold in an elementary school or a middle school. Does that answer your question, Rachel?
It does, and we do have programming within school districts as well. So there's a connection there, but I was just curious for the ones that weren't connected to school districts, if that had any type of impact. So thank you.
Yeah.
I definitely have a question. It does move us a little forward, but I want to acknowledge just the heaviness of this, and also recognizing for some of us it's heaviness in just knowing that these things have happened or that potentially will happen again. And for others, it's heaviness that it has happened, right? It has happened to them. So I just want to hold that and also just say how beautiful I think this conversation is, that we clearly have some disagreement and, we're not necessarily all aligned in this, but that we're going about it. We continue on. So just wanted to honor that, share some feelings there. My question has to do with, it might be more of an idea, but in thinking about our individual SOC regions, right? Folks I don't know, I'll be your friend soon. I'm Haley Van Horn, she, her pronouns, System of Care Coordinator in Lane County. And we have started, since I stepped into this role almost 3 years ago, you guys, 3 years, we've started really having conversations, which we hope to have more of this year, about what does it mean for our system of care to advocate for changes at the legislative level. And just a little bit of background about here in Lane County, I think that you might find yourself in a similar role, but as a county employee, I'm not allowed to do any such thing, nor am I allowed to be involved in any such thing. So it puts, endeavors of any type of advocacy of just being non-existent. And so our system of care also is made up by a lot of nonprofits who have it similarly written in, right? So what we're wanting to do is get very clear in our language and our literature about what we can or cannot do as our local regional system of care, while also being very thoughtful and intentional about being sure to promote opportunities where folks can get involved. So I guess my question would be how other system of cares navigate that, if they have language to share. And then my kind of idea, I suppose, is that we could share a common resource for how to promote opportunities for involvement. Like, obviously, I always refer people to the SOCAC. I mean, come on, that's a given. But just like other opportunities to be able to voice and really push for change in a way that maybe our system of care as a whole is not allowed to do in Lane County. So my question is, how other SOCs navigate this? And then what do you think of my idea about maybe a shared resource? Just some ideas. And that's for everybody, not just our wonderful facilitators. Please, Chris.
So we don't have any language around it because I'm with the CCO, which is a little bit different. And so that's a really good question. I agree that it's like how we talk about advocacy and like what that looks like at our systems of care levels. But what we are doing is through our youth and family peer support program coordinator is we are creating a mind map that will go on our systems of care page on our because we have a page that says systems of care on our GOBI and EOCCO websites. And we are putting on there all the local meetings, where youth and families can go and see all the opportunities that they could share their voice at, whether it's paid, and then whether it's paid if they apply or whether it's not paid, that kind of thing. So we are in the process of doing that, and then it will go on to for our counties, but it will also include state, those types of things on that. It's going to be a growth, like it's not something that's like done quite yet, but it'll be on our website that we will be moving, like pointing people to. So if families and youth come to our family and youth leadership committee and they're like, hey, this is an issue, or this is a barrier, this is something I'd love to have more conversation with people about it, then like we'll have that and be able to get them connected in a way that makes them feel that they're being heard, and if we're not the place for it to be. So that's what we're doing locally for our counties, is just creating that mind map, and then it'll be broken down sort of by county. So you'll be like, this is my county, but then this is what's available at the state level, and this is what's available regionally, and things like that.
I love this so much. I can even see different like iterations of this depending on like a specific barrier you're working on in your area, right? I'll follow up, Chris. I'll bother you. Obviously, Joylene, of course I want to hear what you have to say.
I saw you unmute, Haley, and did not want to overstep.
Never.
Hi again, everybody. I really, really love the ideas that are coming in here, and I'm a big fan of integrating, and especially around this, all of the different feelings that folks have based on lived experiences or their professions, right, related to our LCs. My priority is making sure that folks have the opportunity to share their thoughts, their concerns, that if there is still enough time, we have enough opportunity to amend these policies to address concerns, right? And also that folks are prepared when legislative session starts very, very soon to actually step in and testify for what they believe in. And so from that framing, I actually just got approval to invite you all, and you'll get a follow-up through email, literally during this call. Our youth engagement contractors, the Oregon School-Based Health Alliance, they are hosting a youth-focused policy advocacy training this Friday. It's going to be Friday from 3:30 to 5 p.m. And they just confirmed that we are more than welcome to extend this invitation to youth throughout the system of care. So if you are a regional system of care coordinator and you have a whole lot of youth that you think really want to get involved in policy, right? Not so much getting into the nitty-gritty of individual bills or policies. We don't have that capacity yet in this moment, but we do have capacity to make sure they public testimony or even literally a SOCAC or system of care meeting and are prepared to advocate, right? So just sharing those tools. That's happening this Friday, the 17th from 3:30 to 5 If you are interested in that and want me to send you information immediately, please let me know. Otherwise, tomorrow is probably when I'm gonna share to Basecamp and other coordinators to make sure the word gets out to youth. So that's on the youth side. On the family side, next week, Wednesday, I believe same time, 3:30 to 5:30, we are doing a family-focused policy training that NAMI is hosting. We actually have a family rep with lived experience who works at NAMI and is going to be offering that to our family members. He has asked that this first one stay small since it's his first time doing this training, which is typically in person. It's his first time doing it virtual, so he wants the room to stay small for this one. So we're opening it up to SOCAC family reps, and if there is room, depending on how people's availability lines up, I'm more than happy to open that up to family members engaged with your local SOC. Our executive committee has also approved multiple of these trainings. So while this first one is staying small and kind of internal, I'm keeping an eye out for future dates and availability for us to open it up to community more broadly, right? Ideally, it's like, come on, come all, get trained up on advocacy. So those are some opportunities just to keep on your radar. And again, the youth training this Friday is open to all. Thank you.
Yes, Jenny, I'll call on myself. Um, I guess I don't really know what the guidelines and rules and things are around the, the county socks versus the state socks, but I just want to say I am all for breaking down silos in any way, shape, or form. So if there are barriers for the people in the county socks, to see what we can do to break those down so that we can all come together in a space together.
And Haley, I wonder, there's a difference between like the federal prohibition on advocacy for different like Medicaid funded entities have specific rules. Folks who are certified under the 501c3 code of the IRS tax code have certain specific rules, right? So knowing what governs the prohibitions, right? And then figuring out what wiggle room exists within that. Like I know a lot of the 501c3 space, that's traditionally what a regular like community-based nonprofit would be organized under. They often like over apply the restrictions to themselves, and so like they'll say no, we can't lobby or we can't advocate, but really they can. They just need to make sure that they're not spending more than 10% of their budget on that activity. I'm not sure what the Medicaid guidelines are, and then like Medicaid has its thing, but then your county may have its own thing, right? And so like there are layers of rules, and each time you get a new layer, it's typically you're getting more and more restrictive, right? You're like coming through the filter, and each hole gets smaller. So my only suggestion would be like know what wiggle room does legally exist for you, and then figure out how to operate appropriately within that. To like advocacy is one thing, education is something else, right? Like supporting folks to do advocacy is sometimes something different than you doing advocacy on your own, right? So what are those sort of gray areas, and how do you navigate those in a way that won't get your or employer in trouble and won't get your boss mad at you?
Absolutely. And it's something that we just want to be more clear about, even explaining. Like for your CCOs, it is this. For your SOC coordinator and SOC team who are Lane County employees, it's this. Just letting people know on the front end, right? Yeah. But you're absolutely right. And we are fortunate enough to have some of our 501c3 folks, like you said, who are in the nonprofit realm, who are very well educated on it. And they're the ones that will really guide the conversation or be able to guide the work of like, here's what we can do that fits within all of the realms.
That might be an interesting conversation to also see about having with like in your local coordinator, sort of your separate space, right? Or like what are we currently doing? Like this may be recorded, posted online, not the safest place to have that like we're doing this. Is that out of bounds?
Yeah.
Kind of
Yeah.
conversation, right? But in a place where you're not putting your peers at risk might be a really useful sort of like who's doing what, because I think the complexities of cross system change work, the rules for you, Haley, might be very different from the rules for Christina, even though your jobs are the same from the outside. All of those different policies and layers may and have an end result that's different for each different person who's doing that local system coordinator job.
Definitely. Definitely. Thank you, Anna, and thank you all. I appreciate it and look forward to further conversations.
The other topics or questions that folks have?
Yeah, I don't know if you saw in the chat. I did have a question from earlier, the conversation about, creating a restraint and seclusion language that goes across all of the settings. And I just recently became aware of the fact that there are training homes for people with intellectual and developmental disabilities versus treatment homes for people with mental health, which I just want to say I think that's disgusting. But anyways, that being said, is the same, does that go across both of those settings, training versus treatment homes?
No. In the ODDS setting, Office of Developmental Disability Services, most of the facilities that they license and certify and oversee are not considered treatment. This bill only addresses places that are qualify under a treatment, except for the school setting. So they are not included, Jenny, in this.
And I guess that's a problem to address on another day. The
Yeah,
fact
I
that
mean,
it's soothing and not treatment, and that language and how pathologizing and ableist it is, and all those things. Yes.
and they're not even considered residential. Like they are considered an in-home placement, even though it's not the child's home of origin. Um, I don't.
And like,
I'm
do
not
people
an
go
expert in
home
that
to get
policy.
trained?
I'm
Like you
sorry.
don't go home. Oh, it's just the whole idea too of you're in a home where you're being trained. Like home is where you go to relax after you've been trained. So living in a training home must be a whole lot of behavior modification training going on, and that makes me sad.
And I've actually never heard the phrase training home. I totally believe you. That's not I can't even speak to that because that's like well outside of my policy expertise.
Yeah, I'd never heard of it either until I was researching on this bill and I saw that those are two separate and they've differentiated that language and I was like, yikes.
Christy, I don't know if you had other topics that you wanted us to cover today, or if there's anyone else in the room that has. Christy?
No, no, I didn't have anything else.
And I'm sorry I missed your question in the chat, Jenny. Not trying to ignore you, I promise.
Can
Well,
we quickly review what happens next? Just really, really fast, like what happens from here?
yeah, great suggestion, Haley. So for the legislative concept 346, the regulatory reform bill that we spent most of this time discussing, that is going to get redrafted. It's such a confusing bill as it is. And then like I said, there are some sections that are in there that don't do anything. So we're going to pull those out. So it's like slightly shorter and, all of the amendments that have come in through these public processes that we've had will be incorporated, and then that will come out and it will exist on OLIS, on the Oregon Legislative Information System, for folks to review. That we expect there to be a hearing in a House committee. That will be another opportunity for public comment, public engagement. After that hearing is when amendments can happen again. So another round of changes, improvements, adjustments to that bill. Because it has some things that will cost money, it will go to the Ways and Means Committee, which is the budget committee of the legislature. They too will have a hearing on it. When in those hearings, they really just focus on the money. They don't really, the policy work is supposed to be handled in the policy committee. We also expect there to be hearings on the Senate side to make sure that both chambers have opportunity to dig in and have some policy conversations around it. And the SOCAC will be using our information channels to put out like, hey, there's a hearing on this, here's when this hearing is, or here's what the hearing room is going to be, or whatever. I don't know if you had more process questions, but that's the somewhat messy answer to process.
No, so it sounds really quick and easy for everyone involved.
Super quick, easy to understand. Yeah.
Totally. This whole system makes complete sense. And
those legislative council and legislative concept, no reason why we shouldn't just call them the same thing, even though they're different things.
I think we can all agree we just love this. We love all of it. We love it. Great.
It's been really fun. Yeah. Yeah, and same for the other bill, legislative concept 429 around council composition. Because there is money on it, it will go from a House committee, policy committee, down to Ways and Means. And then the respite concept that we also briefly mentioned will start on the Senate side. We'll have a Senate policy hearing and then go to Ways and Means, and we'll likely not have a House hearing unless it's controversial in some way when it goes through the Senate. Thanks for being here, Heather. Nope, she already left. Never mind. Joylene is pointing out in the chat, she has a recording of a training for policy advocacy for nonprofit organizations. If you want to learn more about that from someone who's really fun to watch.
For the record, I am not actually in it. I just helped create it. So sorry. It's hosted by the Nonprofit Association of Oregon, and they may or may not be as fun as I am to watch in a training. Enjoy.
I mean, I don't know them, but I'm going to guess no. Well, I don't have anything else to say. I want to hold space in case anyone else has lingering comments or questions. I heard that if you count to 10 really slowly, that counts as a therapeutic pause. So I just did that. I don't know if you all just feel like therapized as a result, but
So therapized.
your background and Christiana's background together are like making me feel a little therapized. Thanks for the peaceful trees.
Yes, those trees are very therapizing.
Therapizing.
Yes.
Joylene, did you come on camera to say something or just to be present? Okay,
Just to be present with you all.
appreciate that. Well, and I'm going to say thank you all very much for your time today. You know my inbox is always open. I'm happy to hear from you and do my best to answer your questions. And we look forward to connecting with you somewhere, hopefully in person, in the not too distant future. Thanks, everybody. Appreciate it.
Thank you.